Hello everyone, today we are going to present on the topic parental dosage form, which is a part of module 4 B.PHARM. So first of all, we look at the definition of parental products. So parental refers injectable route of administration, and it is derived from Greek words para, which mean outside, and enter or intestine. So it is a route of administration other than the oral route. Parental is done prior to development of dosage form. It is essential that certain fundamental physical and chemical properties of the drug, molecule, and other derivative properties of the drug are to be determined. Next, we will look at the types. So first of all, based on route of administration, they are divided as intravenous, injected into the vein; intramuscular, into the muscle; subcutaneous, under the skin; intradermal, into the skin; intra-articular, into the joints; intrasynovial, joint fluid area; intraosseous, into the bone; intracerebral, into the brain; intraspinal, into the spinal column; intrathecal, in the spinal fluid; intra-arterial, into the arteries; intracardiac, into the heart; endothecal, down the trachea. Now, based on volume, they are divided in two types. First is small volume parenterals. So these are sterile, pyrogen-free injected products that are usually packed in volumes up to 100 ml. Next are large volume parenterals, LVP. These are sterile, pyrogen-free injected products that are usually packed in volume more than 100 ml, ranging from 101 ml to 1000 ml. Now we look at the advantages. If the drug is not absorbed orally, it can be given parenterally. Drug which is unstable in GIT, that is our gastrointestinal tract, can be given parenterally. Drugs which are undergoing extensive first pass metabolism are given parenterally, which avoid the first pass metabolism. When patient needs rapid drug action in emergency situation as onset of action, parental is required as it is rapid. When patient is uncooperative, uncautious in the cases of accident, surgery, etc. Also, parental has drug bioavailability up to the 100%. Prolonged drug action is possible. Parenteral therapy provides the mean of correcting serious disturbances of fluid and electronic balances. Patient compliance problems are largely avoided. When food cannot be taken by mouth, total nutritional requirement can be supplied by the parenteral route. Now, disadvantages. Most inconvenient route of administration, as it can cause pain upon injection. Generally need medical expert for administration like physician or nurse, usually in hospital or clinic. If administered by patients themselves, need good training. It requires strict adherence to aseptic procedure. It requires more than to administer by other route. Chances of improper dosing are more. Chances of adverse effects are more. Danger of blood clot formation is there. Drug cannot be recovered in adverse condition as it is irreversible. The manufacturing and package requirements of parental dosage form are most costly than the other dosage forms. So now the basic criteria of parenteral preparation. First, that it should be sterile, which means it should be free from any living and detectable microorganisms. It should be free from pyrogen, which cause the body temperature to rise. It should be free from visible particulate matters, as it may cause embolism. Embolism means blocking the blood capillaries. It should be isotonic, so it can protect the IBCs, red blood cells. So now the challenge in parental preparation. So first is drug solubility. In comparison to solution and emulsion, the drug substances should be soluble and should remain soluble during the entire shelf life of the drug products. When drug substances are not soluble, dissolution can be achieved by the use of co-solvents, surfactants, etc., or eventually the solubility enhancers such as cyclodextrin for the formation of inclusion complex. So now the pH. The pH is one of the critical aspects of parental preparation, which should have a pH close to the physiological one. However, in certain cases, a compromise should be found between the pH, ensuring the stability of the drug substance, such as for peptides, they require alkaline pH, or protein at the pH close to their isoelectric point and the physiological one. In all cases, large volume preparation, more than 100 ml as defined in pharmacopoeia, should not contain a pH buffer, as the blood has already a buffer effect property that could enter into competition with the injected drug product. Now the sterilization process. The process of sterilization should be selected according to the characteristics of the parenteral preparations. For instance, for heat steam sterilization, aqueous solutions, and dry heat for non-aqueous solution. But in any case, it can be justified by the nature of a primary container. Now, the drug stability. The stability of the drug substance is another critical point that a formulator can face during the development of the formulation. Unstable drug substances will lead to formation of new impurity, jeopardizing the safety of use of preparations. When the use of a stabilizer is justified, for instance, the use of mannitol as free radical scavenger or cysteine in paracetamol solution for injection, it should be included at the minimum concentration demonstrated to be efficient at release and during the entire shelf life. In the cases for powders of injection or infusion obtained through a freeze drying process, the use of bulking agents such as mannitol or cryoprotector will be needed when the dose of drug substance cannot ensure solely the formation of acceptable cake. Pharmaceutical factors affecting parenteral administration. The first is solubility of drug in volume of injection. Before a drug is administered via intravenous injection, it should be completely solubilized in water. Volume of injection can be determined by the extent of drug solubility in its intended vehicle and the dose required for the desired therapeutic effect. Vehicle nature. The drug in aqueous vehicle can be administered by any parenteral route, while those in non-aqueous vehicles are administered intramuscularly. Intravenous routes are used for drug in mixed solvent system, but drug precipitation at the infusion site should be prevented. Third is the type of dosage form. Parenteral dosage form includes solution, suspension, and sterile solids for reconstitution. Suspensions are administered via intramuscular or subcutaneous route. The drugs to be administered intravenously or by any other parenteral route in which the drug directly enters the biological fluid or sensitive organ tissue like brain or eye should not contain any particles. Before administering the sterile solids via intravenous route, they are dissolved in reconstituting diluents. Now, formulation ingredients. The parenteral formulation are made up of therapeutically significant active pharmaceutical ingredients and various active and inactive excipients. Antimicrobial agents are added to the multi-dose parenterals for preserving the sterility. Surface active agents such as polysorbate 80 are added for maintaining drug solubility in the solution vehicle. pH and osmolarity of injectable solution. Injection should be formulated at a pH and osmolarity similar to that of the biological fluids. However, this is not possible for those parenteral dosage forms that are unstable at neutral pH. Thus, they should be formulated at pH at which they are stable. Some parenteral formulation are hyperosmotic with biological fluids. They contain a high dose of active ingredients to achieve the desired biological activity. Formulation of injections. The first is solute. Active pharmaceutical ingredients and excipients should be selected such that their quality is best suited for parenteral administration. Low microbial level enhances the effectiveness of either the aseptic or terminal sterilization process used for the preparation. The non-pyrogenic ingredients in a similar manner enhance the non-pyrogenicity of the finished injectable route. It is a common GMP procedure to establish microbial and endotoxin limits on active pharmaceutical ingredients and other excipients. Next are the vehicles. Both aqueous and non-aqueous vehicles can be used in formulation as per the requirements. First are the aqueous vehicles. Water for injection USP. It is the most commonly used solvent in large-scale manufacturing of injections. Second point, its purification is carried by distillation or reverse osmosis, and the water fulfills the standard same as of purified water for the presence of total solids, which is not more than 1 mg per 100 ml of water for injection USP and may not contain any added substances. Next is sterile water injection USP. It is packed in single dose containers of 1 liter capacity. It should be free from pyrogens and should have endotoxin in acceptable level up to 0.25 USP endotoxin units per milliliter. Non-aqueous vehicle. An aqueous vehicle cannot be used for an air injection if the added drug has limited water solubility or is prone to hydrolysis. Due to these physical or chemical factors, aqueous vehicles are used limitedly and non-aqueous vehicles are the only alternative. The examples of non-aqueous vehicles are fixed or vegetable oils like corn, olive, peanuts, soybean, etc., ethyl oleate, isopropyl myristate, benzyl benzoate, etc. Now the additives. The following high quality solutes should be used in formulation of parental products. First are the medicaments. These are the active ingredients and are sterilized before adding to the formulation. Second is additives. The following additives are added to increase the utility and stability of parental products. Now they are divided into two. First is solubilizers. These are added to maintain the solubility of slightly soluble drugs by increasing their solubility. For example, ethyl alcohol, polysorbate 20, 40, 80, PAG 300, PAG 40, etc. The next are antioxidants. Many drugs in solution degrade by oxidation reaction mediated by free radical or molecular oxygen. Metal, hydrogen, and hydroxyl ions catalyze such oxidative decomposition. Drugs with a favorable oxidation potential are more susceptible to oxidation. Formulation of large volume parenterals. Large volume parenterals are sterile aqueous solution or emulsions having water for injection as its main component. They are formulated as single dose injection administered by intravenous infusions. They are packed and administered by large volumes. They should be free of particles before administration. Sometimes additional drugs are added to them by either injecting small volume parenterals to the administration sets or by the piggy bank method. Large volume parental products include infusion fluids, total parental nutrition solutions, intravenous antibiotics, patient controlled analgesia, dialysis fluids, and irrigation solutions. Now the formulation of lyophilized products. Lyophilized or freeze-dried products are prepared by freeze drying, and this process is known as lyophilization or cyclodesiccation. It is a dehydration process used for preserving a perishable material or making the material more convenient for transport. Freeze drying works by freezing the material and then reducing the surrounding pressure so that the frozen water in the material directly supplies from the solid phase to the gas phase. Now, importance of isotonicity. Isotonicity is important for parental formulation because if the solution is isotonic with blood, the possibility of product penetrating the RBCs and causing hemolysis is reduced. Solution having less osmotic pressure than the blood plasma is hypotonic, and solution having more osmotic pressure than the blood plasma is hypertonic. In hypertonic solution, water diffuses into the RBC causing them to swell and finally burst. Example, hemolysis. In a hypertonic solution, water diffuses out of the RBCs, causing them to shrink. In isotonic solution, for example, 0.9% sodium chloride, the RBC maintain their tonicity. You can see that also in the figure given below.
Now we will learn about the production procedure. So first of all, there is planning and scheduling. In that, raw material is managed, in which we have a raw material and API and also the packaging material. Also for the planning, the equipment, facility, documentation and personals are done, and then manufacturing requirements are completed. Then we will move to manufacturing, bulk analysis, sterilization, aseptic filling, quality test, visual inspection, finishing, label and packaging, and warehousing. We will study them all in detail one by one. The manufacturing of parental involves following steps. So, first of all, there is cleaning and washing of container enclosures. Then there is preparation of solutions, sterilization, filling and sealing, packaging and labeling. The cleaning and washing of container. First of all, the vials are soaked in detergent solution overnight. This removes any sticking particle, grease, etc. from them. Then the vials are washed 3 to 4 times with tap water to soap solution. The vials are washed with 1% hydrochloric acid and then again with tap water to remove surface alkalinity. Then the vials are finally rinsed with deionized water followed with distilled water and sterilized for 4 hours at 200 degrees Celsius. Then the rubber closures are boiled with 1% detergent solution for 30 minutes followed by washing and with tap water to remove the detergent. Then they are again boiled for 30 minutes with 1% hydrochloric acid solution and washed with tap water. Then they are boiled with 1% sodium carbonate and again washed. Thereafter, the closures are treated with the bacteriostatic solution, washed 3 to 4 times with pyrogen-free water, and sterilized by autoclaving for 30 minutes at 115 degrees Celsius. Then we have the preparation of solutions. The active pharmaceutical ingredient is completely dissolved in water for injection with a constant stirring. Then the other excipients are added one at a time with stirring to make them dissolve. The desired pH is adjusted by using buffer agent like sodium hydroxide and hydrochloric acid. The volume is made up with water for injection and pH is readjusted if required. Sterilization. Parenteral product except those containing thermolabile substance after being filled and sealed in final container are sterilized, and this process is termed terminal sterilization. So for sterilizing thermolabile products, non-thermal methods are used. These methods involve filtration through bacteria-proof filter in some thermolabile preparation, example colloid, oleogenous solution, suspension, and emulsion. Each component is sterilized separately and the product is formulated and proceeded aseptically. Sterilization by radiation is also a non-thermal method. Dry solids are effectively sterilized by ionized radiation. Gaseous sterilization is not preferred when glass container or other impermeable barriers may prevent the permeation of gas into the material. Filling and sealing of ampule. In this, the first step given below are for filling of ampoules manually are a little more than 1.1 ml of drug solution is gently drawn into the syringe to avoid large number of air bubbles in the liquid. Then the syringe is inverted so that air rises towards the needle and then the plunger is pushed up to expel bubble and leave 1.1 ml in the barrel. The needle is wiped with a cellulose film disc, unlike the filter paper or a cloth, so that no fiber are left on the needle. The ampule is inverted over the needle. Since the needle surface is dry, no liquid will be put on the ampule neck. If the ampule is held straight on and the syringe is reverted for the ampule, the weight of plunger may force a drop of solution from the needle tip, thus contaminating the neck. Once the ampule is settled over the needle, both ampule and the syringe are reverted together and the liquid is gently expelled to prevent splashing into the neck. Finally, the needle tip is touched against the constriction at the bottom of neck to dislodge the last drop of liquid. Then the needle is withdrawn without touching the neck. So this is an illustration of how ampules are filled. As you can see that in this video, this is an ampule filling area. In this, the ampule's neck is heated and it is sealed off, and the extra material which is left is discarded from this area. So now filling and sealing of vials. The filling procedure of glass vials is same as that for ampoules. In vial containing a number of fixed number of dose unit, an excess volume is required to allow the withdrawal of specific number of dose. The vial opening are sealed with rubber closure held in place by a aluminium sealing. A hand gripper is used to put the rubber closure and aluminium seal onto the vial. The vial is more at the risk of contamination since their openings are large than those of ampule. Thus, the rubber closure is should be placed sealed on the vial immediately after filling. During the critical exposure time, the open container should be protected from contamination using a blanket of HEPA filter laminar airflow. We should also note that the difference between ampule and vial is that while an ampule is a glass or plastic container that's generally used to store unstable medical compounds, a vial is a container that is used to store more stable chemicals. Now for the packaging and labeling, container and closure selection. For parental formulation are packed in container, glass or plastic. The container system meant for packaging of parental drugs include ampoules, vials, syringes, cartridge bottles, and bags. As we have earlier studied about vial and ampoule, so as you can see, this is the image of a vial and an ampoule, and ampoules are made from the glass and bags are made up of plastic, and other containers are either made up of glass or plastic, should have a rubber material like rubber stopper for vial and bottle, and rubber plunger and rubber seal for syringe and cartridges. For example, irritation solution are packed in glass bottles having aluminum screw. Storage and distribution. The storage and distribution of water for injection is as important as production. In this, a closed system with air exchange through a filter that removes microorganisms, dirt, and vapors from the air as the tank is filled and emptied. The water for injection should not be held more than 24 hours at room temperature before it is used, but if held at 80 degree, it can be used for a longer period of time. The distribution may be by direct withdrawal from tank or in a large plant through a pipe system. When a pipe system is used, precaution must be followed to prevent the contamination with welding stainless steel pipe, elimination of or pockets in which the water can stagnate for long period, and throughout cleaning and sanitation at frequent interval is also required. Layout of sterile product area. The sterile product area should be free from microbial contamination. The particle size not more than zero point 0.5 micrometer should be present in the area. The complete area is divided into cleanup area, preparation area, aseptic area, quarantine area, and finishing and packaging. These areas should be constructed and designed such that they can be effectively cleaned, operations can be carried out effectively, and also the personnel feel comfortable in the environment. So, as you can see, this is our production area. This is office preparation and compounding, cleanup area, and we have here sterilization unit, quarantine area, quality control. This is service area, sterile area. This is also sterile area, airlock, grown area, and pre-entry washing. Also, this is a flowchart of how we do things. First of all, material and equipment, they are sent to cleanup area. Also, they are then to preparation area. Then aseptic filling area, quarantine, sterilization is also done in between. Finishing and packaging and storage and shipping are done. Clean room classified area. The clean or the buffer room is secondary engineering control. It houses the primary engineering control where the aseptic compounding is actually performed. The clean room is specially constructed enclosed area which contains one or more clean zone, where the concentration of air particle is controlled using HEPA filter, continuous air circulation, and a physical barrier to non-filtered area. These are the clean room area and their property. This is class 10,000. In class 10,000, the 10,000 or less particle of zero point 0.5 micron and size large and larger size exists in given cubic foot of area. This is class 1000 and class 100. Quality control. The three general area of quality control are incoming stock, manufacturing, and finished product. For sterile products, incoming stock control encompasses routine tests on all ingredients as well as spatial evaluations such as a pyrogen test on water for injection, glass test on containers, and identity test on rubber closures. It may also be necessary to perform microbial load tests to determine the number and type of microorganism present. The production control includes all the final assays and tests to which the product is subjected. In addition to the test and biological test, a sterile product is subjected to leak test, clarity test, pyrogen test, and sterility test. Quality control test of parenteral product. The parenteral product should undergo the most stringent quality control test as they are meant to be used within the body. These products are monitored for sterility and biologens to make sure that they possess the required feature. The tests performed for quality control test of parenteral are leaker test, clarity test, pyrogen test, sterility test, particulate matter monitoring. So, first of all, leaker tests. The ampules are sealed by tip sealing and pulled sealing method. Due to improper handling, there are chances that the ampules are incompletely sealed and crack may appear around the seal or at the base during the process of sealing. Therefore, the leak test is used to identify the improper filling and sealing of ampule, and if found, they are rejected. Then we have clarity test. The clarity test is required for preventing the distribution and use of parental product have particulate matter. Clarity is a factor that is needed to be considered seriously in parental preparation. Clarity testing is mainly performed through human visuals inspection of containers in the direct light against a black and a white background. As a result, the transparent particles are visible against the black background and the colored particles are visible against the white background. Pyrogen test. First of all, let us understand what are pyrogens. Pyrogens are endotoxin metabolite of microorganisms that increases the body temperature when parental preparation contaminated with them are administered. These are following pyrogen tests. First, we have LAL test. This in vitro test method for detecting pyrogen in the product utilizes the gelling property of lysate of ambuside of Limus polyphemus, which is also known as horseshoe crab. If the pyrogenic endotoxin from gram-negative bacteria are present in the product, a fringe gel is formed within 60 seconds of on incubating the product at 37 degrees Celsius. Then we have our rabbit eye test. For this test, the healthy rabbit maintained under suitable environment and diet before the test are used. Normal and controlled temperature are selected for each animal and are used as the base for easily determining any increase in temperature when test solution is injected. Three rabbits whose temperature differ from each other by not more than 1 degrees and whose body temperature are also normal are selected. The test solution is warmed up to 37 degrees and injected in marginal ear vein of each rabbit, completing each injection within 10 minutes of start of administration. The temperature should be monitored at interval of 30 minutes for 1 to 3 hours after injection. The product is considered to fulfill the requirements if there is not more temperature increase of not more than 0.5 degrees. Sterility testing. Sterility test is a confirmatory test for sterilization products. Parental preparations such as injectable, ophthalmic product, and absorbent cotton are tested by this test, which is performed aseptically to avoid product contamination during the test. Particulate matter monitoring. The presence of particulate matter in a solution to be administered intravenously is considered harmful. Till now, limited data has been procured related to the extent of damage caused by particulate matter, although Gurvan and Gunner have shown in 1964 that in particles of rubber, insoluble chemical, lint, and other foreign chemicals can produce emboli in the vital organs of animal and man. Particulate matters in infusion fluid cause the in, infusion phlebites. The anthracites have a diameter of 4.5 mm, thus the particles of more than 5 mm size should form the basis of evaluation. By using Tyndall effect for analysis, particles of 10 mm size can be viewed. With this, we have come at the end of our today's presentation. These are some of the references which we have used to make this presentation. Hope now this module is clear to all of you.